And welcome to Safety Wars for Friday, December 26, 2025. I can't believe that we're at the end of the year here. Just can't believe it. Wow, did this go by fast. So, anyway, what's going on? How you guys doing out there? I hope you had a wonderful Christmas. We're going to be catching up on some stuff right now. Some of it is... what should I say? Some of it is a little controversial, but no, we don't shy away from controversy. But what we like to do is give both sides. Whether we agree or not, give both sides, unlike everybody else out there. So we're going to be talking about the hepatitis B vaccination from earlier this month. The CDC changed their recommendations. I don't know how much of a policy it is they changed, but they definitely did change their recommendations. And as we know, and this has led to this and other things, right? This was the latest, but earlier in the year when they changed things over, what did they do? They ended up going and the states started regulating the vaccination schedule more, and a group of them got together and made the same recommendations. Mostly, no, and I'm stating fact here, not opinion. Mostly Democratic states stuck together with this and kept with the old stuff. We're going to go into a little bit more in depth and detail here, let you make the decision as to whether or not to vaccinate your children for hepatitis B on that. So that's what we're talking about today, and if we'll see how long it takes, and then we'll talk about some other stuff. So that's what we got going on.
This show is brought to you by Safety FM.
Every day on the job there's a moment. Sometimes you see it, sometimes you don't. Where everything hangs in the balance. A loose bolt, a missed clip, a bad assumption. Or maybe the opposite, a choice made right. The right PPE, the right lockout, the right conversation at just the right time. Some folks call that luck. Here on Safety Wars we call it something else. The kiss of safety. The quiet moment where a safe choice gives you another sunrise, another paycheck, another night with the people you love. And the truth, no policy, no regulation, no binder full of procedures means a thing unless you live it, unless your team lives it, unless safety isn't a chore, it's a culture, a war we fight every day, one small decision at a time.
Hi, this is Jim from Safety Wars. Before we start the program, I want to make sure everyone understands that we often talk about OSHA and EPA citations, along with some other regulatory actions from other agencies, legal cases, and criminal activity. Everyone is innocent until proven guilty in a court of law. Proposed fines are exactly that, and they are often litigated, reduced, or vacated. We use available public records, news accounts, and press releases. We cannot warranty or guarantee the details of any of the stories we share, since we are not directly involved with these stories, at least not most of the time. Enjoy the show.
This show is brought to you by Safety FM.
And good evening. Now, let me point out something here. We have a Christmas album out, and since there are 12 days in Christmas, officially, it's still not too late to stream that to your platform. Some of the reviews I've gotten and things, were, we're sick and tired. And I got to this one point in my life where I was sick and tired of hearing the same old Christmas music, so I stopped listening to it. And then some other stuff came out, different arrangements, different styles. I was like, okay, great. Now we'll start listening to it again once you get children's, oftentimes. this is what you do. You start listening to the old stuff, what you grew up with, the holiday stuff you grew up with and everything. So that's why we have our Christmas commercial here for Safety Wars here, and I'm going to share it with you right now.
This holiday season, turn up the cheer and turn down the risk. Safety Warriors is bringing you a brand new Christmas album packed with holiday classics and original tracks, all with a Safety Wars twist. This holiday season, turn up the cheer and turn down the risk. Safety Warriors is bringing you a brand new Christmas album packed with holiday classics and original tracks, all with a Safety Wars twist. From job sites to long drives home, from toolbox talks to tree trimming, this album brings humor, heart, and safety awareness together, without losing the Christmas spirit. Whether you're an EHS pro, a frontline worker, or just someone who believes everyone deserves to make it home safe for the holidays, this one's for you. Stream the Safety Warriors Christmas album now on Spotify and Apple Music. Just search Safety Warriors Christmas, or hit the link in the show notes. This season, don't just sing along, sing safe, sing smart, sing Safety Wars.
Yes, and that's all available out there. Please download. We've gotten a surprising number of downloads here on this stuff. And some of the reviews I've gotten, longtime friends that I haven't heard about, and basically they said, we can't believe it. Number one. Number two, we'd rather listen to this and all this other stuff because they're burned out on it. So that's what we got. Yes, I know we're 7 minutes in here. So what are we going to do? We're going to talk about the hepatitis B stuff. First of all, and we are going to be sharing websites. Now, we normally don't share websites here and things unless they're government related. And however, this is such an important topic that we're going to be talking about some of the we're going to use in the geneticliteracyproject.org article ad here, and I'll reference it completely. I mean, if they complain, I'll go back to just audio on it. But it's a very serious topic here, and you cannot get the information from a small snippet here of things. So here we have, what is hepatitis B? This is from the mayoclinic.org. Hepatitis B is a serious liver infection caused by the hepatitis B virus. For most people, hepatitis B is a short-term, also called acute, right? Short-term. You should know that if you're a safety person. Acute and chronic, acute, short-term. Acute hepatitis B lasts less than 6 months, but for others, the infection lasts for more than 6 months, called chronic. Chronic hepatitis B raises the risk of liver failure, liver cancer, and serious scarring of the liver, called cirrhosis. Most adults with hepatitis B fully recover, even if their symptoms are bad. Infants and children are more likely to develop a chronic, long-lasting hepatitis B virus infection. A vaccine can prevent infection with hepatitis B virus. For those who get infected, treatment depends on whether the infection is acute or chronic. Some people need medicines, and with serious liver damage from a chronic infection need a liver transplant. If you're infected, taking certain safety measures can help prevent spreading the virus to others. Symptoms. The symptoms start 1 to 4 months after you've been infected. Here are the symptoms. Pain in the stomach area, also called abdomen, dark urine, fever, joint pain, loss of appetite, upset stomach and vomiting, weakness and extreme tiredness, jaundice, which is a yellowing of the whites of the eyes and skin. Depending on skin colors, change may be harder or easier to see. When to see a doctor, you see him right away after you've been exposed immediately. All right? So, and you can then get the vaccination, and if it's a workplace exposure, there are workplace requirements for your employer to have. Now, to do some of the other stuff here. some other background information. Okay, hold on. So, how many children this is from Copilot, right? In the United States, acute hepatitis V cases have been reported, with 20,445 newly reported cases from 47 states in 2025. This reflects significant public health challenge, with the estimated total acute infections reaching 13,300. We could just do this. The 2,126 reported cases in 2022 indicate a stable trend, but the actual number of cases may be higher due to underreporting and asymptomatic cases. CDC has recommended individual-based decision-making for infants born to mothers who test negative for hepatitis B, reflecting ongoing vaccination efforts. All right, so here we have this. Here we're going to go. This is from the cdc.gov. Rates of reported cases of acute hepatitis B by age group. As you can see, we're on the downward trend. Now, we had this whole thing is about children getting the vaccination shortly after birth, within 30 days here. And parents are like, look, my kids are not going to be at risk for this. Why are we doing this? This has been many commentators, no, you have to make your decision for yourself and your medical provider, what your specific situation is here. We are here to give you more information. And as Todd Conklin says, more information does not make you more stupid. At least, I'll say, at least most of the time. Right? So here we have the bottom line, the blue line, if you could see that. Right? And we have, right near 2008, 0.1 cases per 100,000. I mean, one case in a million. 2009, one case in a million for 0 to 19. 2010, one case in a million. 2011, we are hitting 0, and it's been 0 from 2011 onward here for cases that are known. And everything else here, you have 40 to 49, that's been down, that's been up, right? And they're all trending downward, all of these cases. So hepatitis B is trending downward, right? Symptoms and causes. In the year 2000, there were 92 reported cases of acute hepatitis in Indiana, with one case resulting in a death. This figure reflects the overall incidence of hepatitis B in that year during the state. Okay, so here we go. This is from November 5th, 2004. Acute hepatitis B among children and adolescents is from morbidity, right? Mortality, morbidity, weekly report. All right. Since 1991, this is acute hepatitis B among children and adolescents in the United States, 1990 to 2002. So, from what I recall, the recommendations were starting to be made in 91, depending on where you were, and the CDC roughly early 2000s. We have the whole article here. Since the 1991 adoption of the comprehensive strategy to eliminate hepatitis B transmission in the U.S., the incidence of acute hepatitis B has declined steadily. Declines have been the greatest among children born after 1991 recommendations for universal infant hepatitis B vaccination were implemented. In 1995, the elimination strategy was expanded to include routine vaccination of all adolescents ages 11 to 12, and in 1999, to include children aged less than 18 who had not been vaccinated previously. Described the epidemiology of acute hepatitis B in children and adolescents in the United States, CDC analyzed notifiable disease surveillance data collected during 1990 to 2002 and data collected during the 2001 to 2002 through enhanced surveillance of reported cases of acute hepatitis B in children born after 1990. This report summarizes the results of that analysis, which indicate that the rate of acute hepatitis V in children and adolescents decreased 89% during 1990 to 2002, and that racial disparities in hepatitis V incidence have narrowed. Many confirmed cases in persons born after 1990 occurred among international adoptees and other children born outside the U.S. Continued implementation of, now remember this, 2004 this came out. Continued implementation of the hepatitis V elimination strategy and accurate surveillance data to monitor the impact of vaccination are necessary to sustain the decline of acute hepatitis V among children. Cases of acute hepatitis V were reported weekly to Centers for Disease Control by all 50 states and the District of Columbia. Acute hepatitis V rates were calculated per 100,000 population by using population denominators for the U.S. Census Bureau. Again, that's that census data that we were always talking about. Acute hepatitis V was defined as an acute illness with discrete onset of symptoms and jaundice or elevated serum elevated serum aminotransferase levels, and 2, laboratory evidence of either IgM antibody to hepatitis V core antigen or hepatitis V surface antigen. Since March 2001, CDC has conducted enhanced hepatitis V surveillance, contacting states to confirm reported cases of acute hepatitis V in persons born after 1990. State surveillance staff members were asked to verify each of that. So let's go here. All right, this goes on and on. What's the meat of this? All right, they have a nice little graph here. Let me see if I can zoom in on it here. All right, so they were doing this from 90. So when they started to, it started to go all the way down in 2002, right? It was basically from 1990 to 2002, basically non-existent here. 0 to 4 years, all went down. 15 to 19, all went down. Acute hepatitis went down and was trending downward and with everything. So with all races here, Asian and Pacific Islander, Black, African and Indian, Alaskan Native, and white went way down. Everything was trending downward. With this, here's our table here. So what's the idea? The whole point of this is that the incidence of hepatitis V was going down when they started with this here. I don't think you're getting information from the critics of the CDC with this. Now, one thing, let me go in here and we're going to put in here, what is the transmission vector of Hep B? Right? Transmitted through contaminated hepatitis A, transmitted through contaminated food and water, sexual contact with an infected person. Hepatitis V spread through blood, sexual contact, and from mother to child during childbirth. Hepatitis C primarily spread through contaminated blood, including unsafe injections and medical procedures. Also, I'm going to add, I have at least 2 other people that received it from their spouse during, intimate relations. Hepatitis D occurs in individuals already infected with hepatitis V, worsening the severity of hepatitis B virus. And hepatitis E is usually transmitted through contaminated food, with outbreaks common in regions lacking clean sanitation. So that's the vector here. So let's get down to the Centers for Disease Control, what their position is here. So there are 2 articles from the CDC. Let's start with the December 5th one. ACIP. That's the advisory committee. This is from December 5th. The advisory committee on immunization process. Yeah, let me share this. I'm looking at myself here, right? This is from, who released it? Media@cdc.gov. ACIP recommends individual-based decision making for a hepatitis B vaccine for infants born to women who test negative for the virus. So this is for women who test negative for the virus. Now, one of the subsequent articles we're going to share with you explains what that means and what the contrary viewpoint is on this, right? And, again, they're working on old info, but they cannot, right? We cannot do a double, it's unethical. Ever since the Nuremberg codes, I believe that's what they're called, to go and experiment on human beings with a double-blind study with a curable and treatable illness. A curable, preventable illness. Like hepatitis. So you can't say we're going to give this population of people medicine, and this population we're going to give the people no medicine, and we're going to see what happens. The people that have no medicine have a deadly illness now, right? Versus the other one, versus the other group. Can't do that. That's not ethical, right? With that, ever since World War II. Unless, of course, you are in this country and in Western Europe, and most parts of Europe, with that. Other countries, not so ethical, depending on where you go. And you could go and find that out, what countries do that kind of experimentation. So, one of them is obvious, right? This is from the CDC and the Advisory Committee on Immunization Practices, ACIP, today voted 8-3 to recommend individual-based decision-making for parents deciding whether to give the hepatitis B vaccine, including the birth dose, to infants born to women who test negative for the virus. For those infants not receiving the birth dose, ACIP suggested in its recommendation that the initial dose be administered no earlier than 2 months of age. So let's repeat that. For those infants not receiving the birth dose, ACIP suggested in its recommendation that the initial dose be administered no earlier than 2 months of age. So birth dose, if born to women who test negative for the virus, right? Letting them decide. Right now, before this, it was almost mandatory, but it's mandatory up to the point of, you have to be compelled, right? I don't think they're going to hold a gun to your head and tell you you have to have a vaccination yet. Believe me, those days are coming. I think we keep going down this road. Individual-based decision-making, known on the CDC immunizations schedules as shared clinical decision-making, means that the parents and healthcare providers should consider vaccine benefits, vaccine risks, and infection risks, and that the parents consult with their healthcare provider and decide when or if their child will begin the hepatitis B vaccine series. The committee said parents and healthcare providers should consider whether there are infection risks, such as a household member who has hepatitis B, right, or frequent contact with persons who have emigrated from areas where hepatitis B is common. ACIP also voted to recommend that when evaluating the need for a subsequent hepatitis B vaccine dose in children, parents should consult with healthcare providers to decide whether to test the antibodies levels to hepatitis surface antigen and to evaluate adequacy of protection through serology results. These recommendations on hepatitis B maintain consistency of coverage for all payment mechanisms, including entitlement programs, and they go through the list here. ACIP on September 19th voted to recommend that all pregnant women be tested for hepatitis B, a test that is covered across all insurance programs. And it goes on. With that, a presentation from Cynthia Navison, PhD, on the decline of the hepatitis B disease, for instance, in 1985, concluded that the universal birth dose contribution to acute case decline is likely small, as we just showed you in the raw data. that we have here. It identified sharp declines in post-transfusion hepatitis V transmission due to advanced blood screening, improved dialysis practices, and needle exchange programs. It also acknowledged a 2019 study that found that 57.9% of estimated births of women who test positive for the hepatitis V surface antigen were attributed to non-U.S. born women, mainly from highly endemic. Here we go. Mainly from high endemicity countries, meaning it's endemic there, highly endemic. The study reported that 0.5% of pregnancies in the U.S. are to women who test positive for the hepatitis V surface antigen, which is the most significant risk to newborns for being infected with the virus. And there was another thing, right? And and everyone makes nice with that. And then December 16th, the CDC today adopted individual-based decision-making for hepatitis V immunization for parents deciding whether to give hepatitis B vaccine, including the birth dose of infants born to women who test negative for the virus. For those infants not receiving the birth dose, it is suggested that the initial dose be administered no earlier than 2 months of age. Individual-based decision-making, referred to on the CDC immunization schedule as shared clinical decision-making, means that parents and healthcare providers should consider vaccine benefits, vaccine risks, and infection risk, and that parents should consult with their healthcare provider, which is what my suggestion is. I'm not a doctor. I don't play one on the internet. I don't play one on TV. So you got to check with your medical person, whoever that is. Parents and healthcare providers should consider whether there are infection risks, such as a household member who has hepatitis V or frequent contact with persons who have emigrated from areas where hepatitis V is common. So, right, the bloodborne for example, bloodborne pathogen thing came out in roughly the same time period of the original recommendations in the early 1990s. I forget the exact date. So this is all part of the policy of the government to eradicate hepatitis V. Right? Then they say what they're going to do. They're going to update all their stuff. And CDC is reviewing of secondary recommendations that parents should consult with a healthcare provider on serology testing to determine whether a subsequent hepatitis V vaccine dose is needed. Meaning, hey, you give it, test things out later on. Again, see your doctor on that. All right. So we're going to take a break. I'm going to take a drink, and then we're going to go into everything else. And right, so that's what's going on there, and we'll figure things out.
Safety Wars is streaming now.
SafetyFM.com.
Is your safety training old, stale, and hackneyed? Is your safety trainer still preaching a warped version of behavior-based safety? How about safety training that is designed to actually address and assess your hazards and liabilities and is not standardized baloney from generations ago? Contact the Safety Wars team at safetywars.com or call me, Jim Polzel, at 845-269-5772. Remember, if you are receiving this message, you are the solution to unsafe workplaces.
In an unpredictable world, one voice rises above the chaos. Meet Jim Polzel, a seasoned safety expert who's navigated through some of the most dangerous scenarios, from anthrax, explosive cleanups, disasters, and numerous environmental cleanups, and lived to tell the tale. Now he's bringing his wealth of knowledge, insights, and experiences to you through Safety Wars. From workplace hazards to the hidden dangers in your own home, Jim covers it all with his engaging storytelling. Safety Wars isn't just a podcast. It's your guide to a safer world. Join Jim Polzel and become part of the Safety Wars revolution. Available on Spotify, Apple Podcasts, YouTube, and wherever you get your podcasts and videos. Safety Wars. Your safety is our mission.
silent night, not quite serene. Flashing lights paint the scene. The backup beeps a steady cry. Machines sing louder than the sky. Oh, the noise that keeps us sane. A warning hum, a life refrain. Lie, silent night, except the hum keeps the careless on the run. Don't kill the beep, don't dim the sound. It's the guardian of the ground. Headlights wink, but they can't shout. The engine hums its tireless route, but that beep's a voice we can't ignore. It's the unsung hero at the door. Imagine silence where danger lurks, where wheels roll back and nothing jerks. The beep's annoying, sure it's true, but it saves the likes of me and you. I, silent night, except the hum keeps the careless on the run. Don't kill the beep, don't dim the sound. It's the guardian of the ground.
And that is Safety Warriors with Silent Night, except for that backup alarm. Where did we come up with that song? Anybody who has done construction work on a major project in a residential area, especially back when everybody had pagers and not phones, could relate to that. Because it was like, I keep on thinking that my pager is going off. I hear this beep, beep, beep all night long and all day long. Can you do it? No. And then all of a sudden, no, we can't do that. And then 2 days later, all the backup alarms are gone. Right? So officially, we're not doing it, but unofficially, we ripped everything out. Safety hazard, and that's okay. Yes. So back to the subject at hand. Now, I came across this article from the Genetics Literacy Project. All right. And their byline is science, not ideology. And let me do an about here, right? What's their mission? The Genetic Literacy Project is nonpartisan, media-based science educational, nonprofit promoting constructively disruptive innovations in a range of areas. Hey, sounds like us. Disruptively innovative. Sustainable agriculture, biotechnology, biomedicine, gene editing, vaccines, gene drives to control the vector of diseases by insects and rodents, and the transformative role of artificial intelligence in science. GLP encourages the public, media, policy makers, but ranges beyond that. We encourage transparent regulations that spur innovation. We challenge misinformation and disinformation. We do not compete with genetics focuses publications or any science news site. Rather, we analyze rather than just report, providing meaning and some context. Committed to spurring dialogue, GLB presents a variety of informed viewpoints to challenge ideological silos and partners across partisan divides. GLB stands by two principles: science, not ideology, and fact-based science to serve a public interest. Okay, I'm giving no opinion on this at all. I'm just, again, letting the reader or the listener or the viewer decide for themselves. And I'm going to recommend this. Talk with your medical person. No, I'm not giving you an opinion here one way or another. I'm just here. And this was the best article and the best source I found for the opposing opinion. Now we have the CDC's opinion here. Right now, and their press release, now we're going to go to them. And they also include, to their credit, they include some of the other stuff here, what the whole philosophy is on this kind of stuff. So the article is by Jake Scott from December 18, 2025. Viewpoint: Killing Children. RFK Jr., CDC Trump administration's plan to roll back hepatitis birth dosing will skyrocket cases and lead to preventable diseases. All right. On December 14, 1999, a previously healthy infant was admitted to a Michigan hospital with diarrhea and jaundice. Within hours, doctors diagnosed acute liver failure caused by hepatitis B. She died 3 days later. Her mother had tested positive for hepatitis B at her first prenatal visit. She attended 10 appointments, but somewhere between that positive test and the delivery room, the information vanished. Well, if we recall, 1990s, overwhelming majority of stuff on paper, not electronically. That's Jimmy saying this. All right, so let's add some context to the context. The record provided to the birth hospital stated the mother was hepatitis negative, so it was wrong. By the time the infant received her first vaccine at 2.5 months, the virus had already taken hold. So the infant had already been given the virus, the vaccine. This was not an isolated failure. The Immunization Action Coalition documented more than 500 similar transmissions from 1999 to 2002. Positive tests not reported, results lost, and records transcribed incorrectly. Universal hepatitis B at birth exists precisely because screening systems fail. On December 5th, 2025, the advisor ACEP, we just talked about, voted 8-3 to end universal birth dose recommendations for infants born to mothers who tested negative for hepatitis B surface antigen. In its place, the committee adopted shared clinical decision-making, a framework that removes the default and allows delay of the first dose until at least 2 months of age. Infants born to mothers who are hepatitis B positive or whose status is unknown are still recommended to receive the birth dose. For the first time in decades, the lives of more infants will now again depend on screening systems. So basically, we already know that downward trend for adults and children, everything else. This is Jim talking here. So, right? So my question is this: is this debate a result of success? Meaning we've been so successful, and if you're a safety professional, this should probably sounds familiar. We were so successful that we don't need it anymore. That's basically what did with the smallpox, right? Smallpox, we're so successful, now none of us get smallpox vaccination. This is a thing but people are still getting hepatitis B in significant numbers, so that doesn't really hold water, but I have to ask that question. Are we so successful that we're victims of our own success based on the data that we have here from the CDC and with things, right? Here you go. Unlike adults who clear hepatitis B more than 95% of the time, infants are immunologically defenseless. Approximately 90% of those infected in the first months of life will develop chronic infection. 1 in 4 will die prematurely from cirrhosis or liver cancer, diseases that emerge decades later, long after anyone remembers a mixed vaccine. The lost lab result, or the newborn who never had a chance. When a newborn is exposed at birth, hepatitis B immunoglobulin, which provides immediate and temporary protection, plus the birth dose, is approximately 94% effective. So it's not completely effective. 94% effective when given within the first 12 to 24 hours. The new ACIP guidance allows delay of the first dose until at least 2 months for infants and mothers who test negative. For an exposed newborn, that delay is the ball game. There's no second chance. The committee's decision assumes prenatal screening reliably identifies at-risk infants. It does not. Now, 14% of pregnant women let's get an applause there. That came out as a complete surprise here with that. Hey. All right, I salute them. Pregnant women in the United States are never tested for hepatitis B. About 2% of pregnant women receive no prenatal care at all. Among those who test positive during pregnancy, only a third receive recommended follow-up. And the National Perinatal Hepatitis B Prevention Program identifies fewer than half of infants born to infected mothers each year. Those are the only gaps we can measure. Right? Screening cannot catch what it cannot see. Half of the 2.4 million Americans with chronic hepatitis B do not know that they are infected. People can seroconvert, become newly affected after a negative test. Right? So you take the test at the beginning of the pregnancy, which is usually 40 weeks, and at the end of it, you might be positive. No, stuff happens. We discussed what the vectors are. Infants can be infected by household contacts. The virus survives on surfaces for at least 7 days, and transmission rates among susceptible household contacts of infected persons range from 14 to 60%. Before universal birth dose vaccination, U.S.-born children of immigrant parents who themselves are uninfected still showed hepatitis B rates of 7% to 11% from community exposure alone. The birth dose addressed every one of those vulnerabilities. Pardon me. It did not require perfect screening, perfect records, or perfect follow-up. It simply vaccinated every newborn. There is no new safety signal, 40 years of randomized trials, national surveillance, or long-term follow-up, and long-term, let me start over. 40 years, there is no new safety signal. 40 years of randomized trials, national surveillance, and long-term follow-up have consistently found the birth dose to be safe. A recent systemic review found no benefit to delaying the first dose and no increase in serious adverse events among infants vaccinated at birth. The evidence did not change, the committee did. For clinicians, the ACIP vote creates an immediate practical problem. Federal guidance now conflicts with professional standard of care. During COVID, we went through this, right? Everybody with this professional standard of care. It may or may not be valid, depending on the situation, but the professional standard of care is vaccination at birth. Within hours of the vote, the American Academy of Pediatrics issued a statement calling the decision irresponsible and purposefully misleading. The AAP, American College of Obstetricians and Gynecologists, the American Academy of Family Physicians, and Infectious Disease Society of America have reaffirmed that universal birth dose vaccination remains the standard of care for their members. The Red Book, the AAP's authoritative reference on pediatric infectious diseases, has not changed. Hospital standing orders in most systems have not changed. Physicians now face a choice between following a federal advisory committee that abandoned its own evidence to recommendation framework and instead following the professional societies whose guidelines define their standard of care. This creates immediate medico-legal uncertainty. Never heard of that word, medico-legal uncertainty. In a case involving a preventable perinatal hepatitis B infection, a plaintiff's attorney will cite the AAP guideline, not the ACIP vote. A reconstituted federal panel's deviation from established science does not constitute a defensible standard of care. Where have we heard that before as safety professionals? Following OSHA regulations, EPA regulation, all these other regulations doesn't mean crap when someone gets hurt, someone gets killed, someone gets infected, someone gets cancer, someone gets an occupational illness, you name it. I followed we know this from the popcorn flavorings case here that we've discussed here. So that's something to consider here. So now we've heard that. It's not an affirmative defense usually that, hey, I follow government procedures. Oh, well, what's the standard of care? For now, the answer is clear. Follow the Red Book. But the question of where to look for guidance is no longer simple. ACIP was designed to provide a unified, evidence-based national standard. That function has been compromised. Clinicians must now triangulate between professional society guidelines, state health department directives. California, New York, Illinois, and others have already reaffirmed the birth dose and their own institutional policies. This is not how vaccine guidance is supposed to work in a functioning public health system. Well, you guys broke it during COVID, and that's my comment. Right? Why? Because you did not have qualified people up there. Sorry, you did not have qualified people up there talking about this. You had people who were, you had medical providers up there and governors up there with, selling books, looking good, like they're in control and calm the public down. You had multiple types of this is a fallout from COVID and how it was managed. They could have had and the effect of social media on this stuff too. Let's not forget that. Social media, Doctors Google, Dr. Instagram, Dr. TikTok, now Dr. AI. And their impact on how we viewed things. No, again, fallout. People do not trust the government on this stuff. They have lost, and I have said this for many years now, going on years. They have not worked to build back their credibility with the American public. And now we have these decisions being made. They're controversial. If they're right or wrong, I don't know. I'm not a doctor. But now we have this other situation. Now we have, instead of one group of people not agreeing with or not trusting the government public health service, now we have more people that are not trusting the public health service. So I don't think our situation has gotten better. It's gotten worse here. Oh, yeah. I'm going to get the listener mail on this one. Insurance, and if you want to send it over, jim@safetywars.com. 845-269-5772. Insurance implications deserve close attention. Under the Affordable Care Act, private insurers must cover vaccines recommended by ACIP without cost sharing. The shift to shared clinical decision-making can preserve that coverage. Vaccines under this designation, like meningococcal B, remain covered, but it's only if the CDC director formally adopts a recommendation, publishes it on the immunization schedule. The current HHS secretary has made no secret of his skepticism toward the childhood vaccine schedule. If the implementation or language shifts, if the HHS declines to ratify the recommendation or publishes it in a way that suggests the vaccine is not recommended for routine use, insurers gain room to add friction. Cost-sharing requirements or coverage limitations would transform the birth dose from a default protection to a financial barrier for families without robust insurance. The Vaccines for Children program will continue to provide the vaccine free for Medicaid-eligible and uninsured children, but the VFC administration fees are already inadequate, and the added counseling burden of shared decision-making is not compensated. Safety net clinics. The providers that serve the populations most vulnerable to screening failures face a financial disincentive to engage in the very conversations the new policy requires. This is how vaccine coverage erodes, not through outright prohibitions, but through administrative friction, funding ambiguity, and the quiet accumulation of barriers that fall hardest on those with the thinnest margin for error. Modeling estimates provide 1,400 additional chronic pediatric hepatitis B infections per year, approximately 300 additional cases of liver cancer, and 480 preventable deaths over the lifetime of these children, along with more than $222 million in excess annual healthcare costs. Again, money. It's got to be quantified here with this. But this article, and I'm going to congratulate Jake Scott on this, right, for writing a phenomenal article here. Very well balanced article. We're going to use articles again from this source here, right? So harms will not be distributed equally. The infants most likely to fall through the screening for gaps are those born to families without consistent prenatal care who are uninsured or underinsured or live in communities where healthcare access is already fragmented. And infants who receive the birth dose are more likely to complete the full vaccinating schedule. Removing it raises the risk of children falling behind in all of their immunizations. The birth dose, because I can see that because they're not going to see the doctor as much, number one. And number two, it's, well, if this vaccination is optional, maybe all the other ones are. Maybe all the other ones, why are we doing it? And question, again, good to question, but now you're dealing with questioning of people. You're going to give them information. Are they qualified to make the decision? That's the next question. Will the government make all the healthcare decisions for your children? That's a little bit controversial here, isn't it? The birth dose was a safety net. Safety nets exist for patients the system fails to catch. That is one who will pay for this decision. It is extraordinarily rare for countries to roll back a universal birth dose policy once established because the whole point is protecting infants from predictable screening, follow-up failures. The U.S. is now doing so, not because the science demanded it, but because a reconstituted committee presented with ideology dressed as inquiry voted to let it happen. I disagree with that, but it's okay. We are allowed to disagree in the United States. The infant who died in Michigan in 1999 fell through the gaps that universal vaccination was designed to close. We couldn't figure out something since that, really? On December 5th, ACIP voted to reopen them. Right, and this is Jake Scott, is a clinical associate professor of infectious diseases at Stanford University, and you can follow Jake on X, and I'm going to tag him on it at Jake Scott MD. Right, so anyway, this is it. Any repost should credit the original author, which he did, Jake Scott. Provide links to both the GLP and the original article. Find the University of Minnesota on X at UM News. Right? Here's the link. geneticliteracyproject.org 2025/12/18/viewpoint. And you can go on and on and on. Here it is. If you want to do a screenshot, let's zoom in a little bit more. I'm not only giving you a screenshot, I'm giving you the article. No, I guess not. Great guy. Great article, phenomenal job he did. And I appreciate that when we get down to the bottom of the whole thing, both sides of the argument here. I think we've done that. So I don't know how else to end this. We're going to go, again, you're going to be hearing. Now, let me know what you think. If this was useful, not useful, or not. I like to present this stuff so we are able to get the whole story, and then you decide with that here. And I think we've done that. So for Safety Wars and Safety FM, happy holidays. And oh, by the way, tonight's the first night of Kwanzaa. So for those folks who celebrate Kwanzaa, I don't know what the correct reading is, but whatever that is, I give it to you. So that's all we got here. Well, let's do our outro. And we got a couple minutes early and this was, yes, pre-recorded a little bit. We're going to finish with some AI Safety Warriors music from their album that is available on Spotify, Apple Music, and some other platforms that I don't know about. I don't have the link, but anyway, Safety Warriors, right? There, go check us out. Have a great day, and let's go to our outro.
The views and opinions expressed on this podcast are those of the host and its guest and do not necessarily reflect the official policy or position of the company. Examples of analysis discussed within this podcast are only examples. They should not be utilized in the real world as the only solution available, as they are based only on very limited and dated open source information. Assumptions made within this analysis are not reflective of the position of the company. No part of this podcast may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, mechanical, electronic, recording, or otherwise, without prior written permission of the creator of the podcast, Jay Allen.